Nigerians are calling for the improvement of the health sector to discourage medical tourism as they look forward to a healthier 2018.
Yes, indeed. Now, Vivian Irikefe has the review for 2017.
By the first quarter of 2017, the National Health Insurance Scheme, NHIS, was facing a multi-billion naira scandal. The allegations include financial irregularities, violations of due process, and fraudulent activities by health maintenance organizations, HMOs. For most part of the year, the health sector witnessed the emergence and re-emergence of infectious diseases like Lassa fever after the last outbreak in 2012, which also claimed many lives. Monkeypox virus also exposed the country's vulnerability to preventable and treatable diseases.
For the government, federal government, they need to be proactive, because most times we are reactive. Proactive measure is always very important. We do not have one single comprehensive cancer center. So we're appealing to the government to please do something positive in the year 2018.
Despite all that the government says it's doing to provide universal access to health for everyone, a cross-section of people we spoke to said a lot has not changed.
Government hospital, they are doing whatever they like. They feel that they are on top and they can do whatever they like.
Like going to a general hospital and they will be asking that there is no drugs. Like they will tell you go and buy drugs somewhere. You start looking for drug in general hospital. Can you imagine government hospital?
You need to go to General Hospital Bagada. There's no lift. You have to go to the 3rd floor, and for you to go the first round, come back downstairs. I did this about 15 times every day, because you have to go and buy food, you have to go and buy drugs, you have to go and buy blood. While Nigerians are looking forward to an improved sector, critics want the government to establish state, regional and national public health laboratories for routine medical surveillance before the outbreak of infectious diseases. Vivian Irikefe, TVC News.
All right, in the studio with us is the Chief Executive Officer, Occupational Health and Safety Managers, Ehi Iden. Ehi, good morning and Happy New Year.
Good morning. Happy
Nice
New
to
Year.
see you.
Happy New Year.
Yeah.
Right. 2017 was quite dramatic when it came to the issue of health. And I remember through the year, we had you here sometime to talk about health insurance and HMO-related issues and other things. But when the overview is concerned, how would you rate the health sector in 2017, the performance?
Well, I think we didn't do really well, just like every other year that preceded that year, where because, like you heard in the report, we have always been a reactive society, and that has actually been so visible in our healthcare system in Nigeria. What different countries in the world are doing right now is actually focusing on preventive health. When you focus on preventive health, you reduce the traffic that goes to hospital for curative intervention. And we have not been able to do that. We have not been able to put fund in that direction. Most countries are working with researchers, having the right figures to work with. We don't have that. And it was a very trying moment for us in 2017, because we were faced with a different kind of infection. I mean, CDC had a lot to deal with in that direction. But, you know, these issues are really preventable. And these outbreaks that happened within the year, they all caught us unaware. And I'm not sure we still have lessons we have learned, because when things happen, you learn from what has happened and you used to actually make a plan on how to actually guide against future occurrence. And but
were we really caught unawares when it comes to this cycle of outbreak of diseases? Meningitis, for example, Lassa, those are the diseases that we have to confront every year, and yet government doesn't seem to be proactive. You know, just like you cited in the case of that report, that government is always more reactive. Yeah. But even at that, can you even say that government is really reactive? Come to think of it.
Well, you can't. If you are not proactive, you follow the reactive matrix. So we are reactive. Government was reactive because when it happens, I mean,
reactive would mean that at least you did something to solve the problem.
So you're painting a picture of worse than reactive.
Worse than reactive.
No. We say that the government was reactive because reactive means when the things happen, when the things are already facing us, government is running head-to-head. How can we? Well, that's called damage control.
Yes.
How do we make constitute a team to actually do the damage control? And that's what we kept doing.
Okay, so speaking of damage control, in what way? Take, for example, Lassa outbreak and meningitis. What kind of damage control did you see that was impressive to you in 2017?
Let me speak on the meningitis rather.
Yeah.
When the outbreak happened, because like I said in the interview that we had here, we said we had the meningitis bet, which of course we knew that we're going to have meningitis along the line in our existence. But there was no plan for it. But when it happened, the moment that it happened and government started sourcing for vaccine, that's not proactive, that is reactive. So long as they made that move to start looking for vaccines, to actually, creating public health information system and try to see how they can actually guide against the spread of that meningitis beyond what we had, that's reactive. So no matter how low scale it may be, but there was a move from government. If the government
at least they were able to put it under control
eventually. After 6 months or so,
that it is happening in our country, we don't want to look at it. They would have said, okay, we have no government, but at least there was a lot of cry for help, and which of course help came along the line, and we were able to put it under control.
All right, now the fear sometimes is when we know, or we know, like she was saying, every year there's a period of time these things resurface, especially with the Lassa fever and all of that. Now, the new one that took us unaware, if I have to use, is the monkeypox. Now, when it comes to research, when it comes to collaboration to ensure that vaccines are available for these things, what effort do you think is in place and should be in place for this?
Let's even take it from the very beginning, which of course we've discussed here before. We have to, if we want to be ready for this things, really, government had to actually improve the healthcare funding of Nigeria healthcare system. As at last year, we had 6%
of the budget.
This year, 2018, we have 3.8. And our population is expanding.
It's expanding.
This is where the fundamental issues are. And if you don't have enough funding, like, how do you create intervention? Even look at the research you're talking about. How do you make funds available for researches when there are no funds, when the healthcare system in Nigeria is underfunded? Even looking at the diagnostics, which of course is the bedrock of treatment. We've had a lot of people, prominent people that have died in this country. Let's not look at the ones that died that didn't get attention. Those that died that got attention. Look at Dora Kuyele, look at Ganifa Ohimi. And if you realize that they said, one thing that actually happened was that their cases were misdiagnosed.
Misdiagnosis, yes.
So we don't have, look at the diagnostic system in Nigeria, we don't have enough equipment. Equipment we actually use, like most of them are outdated. Even when we buy equipment, we don't have maintenance culture. And you buy equipment, we have a CT scan in hospitals, we have MRI in hospitals in less than 2 years after installations. They are all damaged, you can't repair them.
And the labs are not there. Even where they exist, they're almost totally ill-equipped. We had to go to Senegal to find out exactly what this monkeypox was all about, if you recall.
Anyway, that's where the center, the West African Center,
hub is.
WHO is. Okay,
so of course we had this cycle of doctors going on strike every now and again. And the most scandalous one that happened in 2017, the huge numbers of doctors leaving the country. About 300 doctors left Nigeria last year, added to the thousands and thousands that have already left over, how many years.
The good news?
Yeah.
You're going to have more living.
Is that good news?
So is that good news?
Yes, that just shocked you because along the line, just imagine you're a doctor. If your son was really trained as a doctor, he's worked for 14, 15 years, he could barely pay his child education fee. You want to work, you have no resources to work. You really have, because if you look at medicine, primarily medicine is humanitarian. And every healthcare professional understands, has been trained within that mindset that you are a humanitarian professional. But you find out that you really want to give the humanitarian service, then you have a lot of brick walls that you meet along the line, and you see yourself not even able to do what you ought to do. I've seen a nurse that took delivery where the suction machine failed. There was no support. She virtually used her mouth to suck the baby's nose, to suck the mucus out. So understand that these are people that have passion and are willing to do this job, but they have no resources to do this job. So at a time in your life, you just get frustrated, you don't know what to do. And that's why you see the flock of Nigerian doctors and health professionals actually going abroad. But understand the fact that globally there's already, indicated that there's going to be a shortage of healthcare workers.
Yes.
And the developing country like Nigeria, what we have here are being exported to fill the shortage we have abroad.
Yeah, and even what is even more shameful is that some of these doctors are leaving for countries like Kenya, countries like Rwanda, countries like South Africa, and all of that. And these are small, excuse me, these are smaller countries with very relative low ratings in so many of these things. But I wonder what they are doing right.
I tell you,
we are not.
It is not the size of the country that really matters. Like we're here when we talked about the health insurance. You remember we read a report where we talked about what's happening in Rwanda healthcare system.
Yeah.
So they just want to be in a place. It's not really because of the money. They want to do their job where the system works, where they can actually go there. What they were taught in school, to put into practice. What they read in books, the machines they've seen in the books, they're able to see those machines visibly and be trained on how to work with these machines. And this is what we don't have in Nigeria. It's just a matter of creating an enabling environment. We don't have that in Nigeria. Not even a time came that the government was talking about backward integration, trying to make doctors who are Nigerian in diaspora to come back to the country to work. A number of them came to Nigeria, and they just found it to like a strange land. And they tried to see what they could do, and when they got frustrated, most of them went back. And that's where we found ourselves in. And the big issue is we must start by trying to see how we can actually improve on our healthcare funding. Like as we said before, in the Abuja Declaration, where the African Union met, it was agreed that, there should be double digits, that's 15% baseline.
Yeah.
But many countries have been implementing this baseline. But Nigeria, we are still, how come a country of about 170 million population, we are having 3.8% of our budget allocated to healthcare?
So if we say that health is wealth, you wonder, is it a case of government not understanding that health is a bedrock on which any kind of development can stand on? Or is it just, what exactly do you think is playing out?
I think it's a misplacement of priority. Things that really matter, we don't give them attention. No country, I repeat, no country can succeed without a healthy population. The success of a country is predicated upon a healthy population, and that's what we're not understanding. We must look at that and put priority in the right place and ensure that, the health of the people are catered for. If you were not healthy, you can't come here and be talking about today. So we need to create a system that can really keep our population healthy so that we can also be productive as a nation.
Okay. We have to leave you here now. He's the CEO of Occupational Health and Safety Managers. Thank you so much for coming on the program.
Thank you
very much. And we wish you a great 2018 ahead.
And a healthier.
And a healthier one.